I'm Sheila Pitts from Sanford, Clear Lake, and this is my Blue Chair story. I'm from Watertown, South Dakota, which has got a fairly bigger hospital, but I choose critical access for a reason. Both my parents are from Clear Lake. They were both born in the hospital that I work in. Funny fact is actually my office used to be the birthing room. So both my parents were born in my office. That home connection, I just felt like I had a calling coming back to this town. I have family in this town. My brother lived in this town for a while. So I had a lot of connection with Clear Lake, and when I got done in nursing school and realized critical access was where I really wanted to be, it was just like, it was right there for me. Well, in Sanford, Clear Lake, I am the Outreach Trauma Coordinator, and I do a variety of everything. It's a different job every day, but the biggest thing I enjoy is bringing specialties to our rural community. A rural nurse is everything. So I do a lot of telemed, which is all through a computer screen, and then I do outreach providers that come to our facility. So I'm their nurse and follow them to help guide our patients through those specialty services. And that is one of the biggest things about being a rural health nurse is the communication, being part of the big picture, being able to take care of our patients, know them by name, and get them to their best outside of the hospital. I love being my patient's best friend or their family. I sit right beside them during all their telemed appointments. I walk them through what's gonna happen. Before the appointment starts or if we're waiting for the doctor, we'll have general chit chat about what's going on in life, kind of get their mind off that what's going on in that room. It's not about just asking the medical questions, it's about asking how their day is and how they're feeling and what's going on outside of the medical field. You know, do they have family around the area? What brought them to Clear Lake? You kind of build that rapport with them by bringing it down to a personal level that's not focused just on their medical care. Just recently, I had a patient that was told that he needed dialysis through Telemed. That was blowing news to him. He was not happy. He didn't know how to take it. Tried to answer as many questions as he had. I wrote down some questions, got him back to the nephrology team. So not every day is peachy, but I try to stay as positive as I can. I believe laughter is the best medicine. You know, if somebody is down in the dumps, just getting a little giggle out of them and just sitting down and talking about growing up on a farm and talking to them about what makes them feel good, you know, and we have that rapport with those patients that you can straight out say how it is, you know. I have a patient in Clear Lake that calls the hospital, and he's got a special name for me. It has something to do with my height. My height is a topic of a lot of conversation throughout the hospital, even with my patients.
So how short are you?
I am 5'1.5" with boots on. Everybody in the hospital knows when this gentleman calls for me, and he'll call me directly with any questions. And so just giving them the comfortability of my office phone number, my direct line, saying, call me anytime. If I don't know something, I will find out for you. For me, it's very rewarding going to work every day and seeing the same patient. There's a lot of days, because if I'm not working on the floor, I'll walk up there and knock on each door. Hey, so-and-so, how's your day going? You know, just acknowledge that they're there. Tell them and be encouraging that, hey, today's your day. You know, I am a caretaker. I have been for many years. But just seeing it from start to finish. You know, I have a patient in our community. I was there when he was diagnosed with cancer, and I'm still there as he's going through his treatment. You get to know these patients so well that you get to, and even with kids, you see them grow up over the years. 8 years, I've seen a lot of kids grow up, and you just become part of their families. And my goal is to get everybody home and feeling better. So I strive on making sure that they're getting the best care that they can have in Clear Lake, and make sure that they feel comfortable coming back if they need to. But it also is a heartwarming feeling to know that I've helped people, because I'm naturally a caregiver and love what I do.